Hello there, thanks for joining us on Health Matters Yet. Another very interesting edition where we are going to x-ray issues that concern you. Our focus is to ensure that you keep healthy and fit. I remain your host, Umo Basi Edit. And today we have in the studio here Dr. Obong Essien, who is the consultant orthopedic surgeon with the Akwa Ibom State Ministry of Health. Hello, doctor. Welcome to the program.
Hello, thank you for having me.
Okay. And then we are going to be discussing several issues about bone matters. Bone, what do you know about bone? Basically, the topic we are looking at today is arthritis. I know that this is a common ailment. A lot of people go down with arthritis. Some people think it's arthritis, meanwhile it's not arthritis. And then some people go to the extent of indulging in some local therapies, all in the name of treating arthritis. And so that's why we had to bring Dr. Bowen into the studio today to do justice to this topic on arthritis. So doctor, what is arthritis?
Okay, thank you for the question. Arthritis is a very interesting topic, very interesting illness that affects a lot of people, especially the middle-aged and elderly people. Arthritis basically is a condition where it affects the joints. In the joint, apart from the bones making up the joint, there's a cartilage, something like a plastic in between the joints. The function of the plastic is to prevent the bones ends from touching each other. So what arthritis does is that it attacks that cartilage, attacks that plastic, destroying it. So in that process, it causes pain, deformity, and other problems the patient may have.
Okay, so and then like you make mention, you said the middle age and the elder. That's like what age bracket now, to be specific?
Okay, arthritis is common amongst people from 50 years and above. Even though younger people can still develop arthritis, depending, there are several causes of arthritis. So, but the common age group is from 50 and above, and those ones may be due to part of aging process and other conditions that they have developed in the course of their lifetime.
Okay, is it genetic or something? Something you inherit?
Yes, there's a group, a type of arthritis that runs in family. That's why you will notice in a particular family, the grandparent had knee pain, the father had knee pain, and now the child is developing knee pain. So there's a type, not all types of arthritis actually, but there is a particular subtype that runs in family.
Okay, so that takes us to the types of arthritis. Could you just highlight some of the types, common ones that we may need to know?
Okay, the common types of arthritis include degenerative arthritis, also called osteoarthritis. That is the one that we commonly see around, common in elderly people. As one gets old, the normal wear and tear of the body can result in arthritis in the joint. That's what we call osteoarthritis. There's another subtype called rheumatoid arthritis. A rheumatoid arthritis is an autoimmune disorder. That is, the body is fighting against itself. So the body recognizes this cartilage as a foreign body, therefore mounting immune response against it, in the process destroying it. What is this kind of rheumatoid arthritis runs in family, commoner in females, runs in family, so you will tend to see, and it affects multiple joints. So you tend to see somebody coming with pains in the fingers, in fact, any joint in the body can be affected. That's rheumatoid arthritis. Then we also have another subtype, the post-traumatic arthritis. Usually, if once any joint in the body is injured, there's a risk that that joint will develop arthritis, irrespective of the age of the patient. Meaning that a 10-year-old child that has sustained a knee injury that has affected the joint has a very high risk of developing post-traumatic arthritis in that knee joint. The same, so irrespective of the age, post-traumatic arthritis can occur. Then there's another subtype, the septic arthritis, usually as a complication of infection in the joint. As we said, the cartilage is prone to being destroyed by either blood cells or inflammatory factors. So if there's an infection in the joint, as part of the inflammatory response, that cartilage gets destroyed, resulting in arthritis. Those are the common cause of arthritis. Then there's another group that may be as a result of deformities around the joint. Usually, especially in the lower limb, the legs down, should be in a straight line, so that when you are standing, your weight passes through a straight line to the ground. But if there's any deformity, especially around the knee, such that the weight of the body is not taking a straight line, the joint now develops some areas of stress that will predispose to developing arthritis in those points.
Okay, now how can somebody readily know that he or she is having arthritis? What are those symptoms associated with arthritis?
Okay, that's a very interesting question. The symptoms of arthritis varies, but the common symptoms that may suggest that what you have is arthritis include pain in that joint. The pain that comes with arthritis usually is like a persistent pain, but it's worse after periods of inactivity, such that by the time you sleep and wake up in the morning, that means you've not been using your joints. By the time you want to start moving, you have severe pain at that point, which may gradually reduce, even though it may not stop completely. The same thing if you sit for a long time. When you want to initiate movement, get up from the sitting position, you feel severe pain at that point. Those kind of pain usually suggest arthritis. Then another symptoms of arthritis is stiffness. The joints gradually become stiff over time. If you discover that you cannot, for example, if it's arthritis in the knee joint, you discover you cannot fully flex or extend your knee over a period of time. Then for the knee joint, you may also have things like what we call locking of the knee, where you suddenly feel the sensation that you cannot either extend your knee completely. It's as if there's something blocking that movement in your knee. That's another feature the patient may present with. Then if the arthritis is affecting joints like the hip joint, you may discover that you walk with a limb. After some time, the leg may appear to be shorter because that cartilage is being destroyed. It now reduces the total length of that limb, so you may have that sensation of one leg being shorter than the other, apart from pain. Then once in a while, you may also have a swelling around that joint.
Wow, in case you're just joining us, the program is Health Matters, and we have here in the studio Dr. Ubong Essien, who is the consultant orthopedic surgeon in Akwa Ibom State Ministry of Health. So we are discussing arthritis today, and what idea do you have about arthritis? Don't touch that dial, just stay glued to your TV screen. So doctor, moving forward, we've talked about the symptoms and the types of arthritis. What would you say are the common causes? What are those things that we are doing and we are not doing right? Apart from maybe genetics, that okay, you are ordinarily predisposed to arthritis. What are those other things that you think are the causes of arthritis?
Okay, apart from genetic, which you've removed, and degenerative, which is as a result of getting old. If all of us get old enough, we eventually have one form of arthritis or another. So that one is not preventable. But other things that can cause arthritis, especially arthritis in the knee and the hip joints, include things like overweight, obesity. Because the more weight you have, that means the more weight those joints have to carry. So it acts as an extra stressor on those joints, and it will fasten the degenerative changes in the joint, resulting in arthritis. The other thing that can cause arthritis is injuries around the joint. And commonly, when we see patients and we ask, have you had injury around the joint, most people tend to think about injury in the immediate past, maybe year or years. But injuries that you sustained even when you were small is a very strong factor that can predispose you to developing arthritis in that joint. Because what happens is that once the joint is injured and the joint surface is no longer straight, as long as the surface is not even, there's that risk that arthritis will set in. Another factor which I mentioned earlier is infection involving any of those joints. And septic arthritis is common in children. So most of these infections are childhood infections that may not have been well treated, well managed. Then as the child or as the person gets older, it now starts developing arthritis in those joints. Then those are the major. Okay, yes, and another common cause is deformities around the joints, bow, neck, legs. As I explained earlier, if the body is of the legs are supposed to be straight, so that the weight of the body is carried in a straight line. So if there's any deformity around the joints, it means the alignment of that limb is not proper. The loading in the joint is not even. So the part of the joint that is carrying extra load will now tend to develop arthritis. So you now discover that for somebody that has a bow leg, he will start having pain around the inner side of the knee. Whereas if the person has a care leg, he will start having arthritis in the outer side of the knee. So all those deformities is better to be corrected early before arthritis sets in. Once arthritis sets in, it complicates the treatment for the deformity and the arthritis.
Okay, are you saying that K leg and bow legs could be corrected?
Yes, care leg and bow leg can be corrected. Can be corrected in childhood, which is the best period. Even in adults, there are procedures that can be done to correct them.
Okay. Yes. Surgery? Through surgery?
Yes, through surgery. But it depends on the cause, especially in children. One of the commonest causes of limb deformities in children is rickets. Okay. So if it's something like rickets, usually by the time you correct the vitamin D deficiency, it corrects on its own. But by the time the child grows into adulthood, surgery will likely be the only option of treatment.
Okay, still talking about the causes, we are looking at sedentary lifestyle, because you see that people in the village, like they have to go to the farm every day, they hardly come down with arthritis. Have you noticed? Or I'm the only person with these statistics?
That is true. Sedentary lifestyle affects almost every facet of the body. What happens is that the body is meant to move. So the inside the joint, apart from the bone, the cartilage that we've talked about, there are ligaments, and there's also fluids, which we call a synovial fluid. It's like it bats the cartilage, it bats the joint. So the more active that joint is, the more this fluid is produced, the more turnover of the fluid, so that the waste material produced by the cartilage, by the bone, is removed faster, new fluid is replaced, and that tends to prevent, has a protective effect on the joint. Whereas if you are inactive, or for whatsoever reason you cannot move a particular joint, there's a high risk that you may end up developing arthritis in that joint.
Okay, now let's go to some misconceptions around arthritis, because there are lots, we have a lot. So are you aware of some of these misconceptions?
Yes, I think one of the common misconceptions is that arthritis is a disease of old people. As I've tried to explain, there are many factors that can cause it. Injuries, infection, deformities. So any of those things, depending on when it occurred, one can develop arthritis. We've seen a 20-year-old coming with arthritis, 40-year-old, even younger, depending on what is causing it. Then another misconception is that exercise worsens arthritis. There are exercises that are actually helpful with arthritis. Just as I said, the joint needs to move. So exercises that involves moving the joint, like swimming, brisk walking, all those exercises are good for the joint. But exercises that tend to put excess load on the joint, like jogging, running, those kind of exercise should be avoided in patients that are developing arthritis.
Okay, how about cold too? Cold, exposure to cold, does it also cause arthritis? Because
there's no evidence that has shown or supported that cold has any direct link with arthritis.
Oh, really? Yes. Okay, because I know that most people usually say if you start having all those joint pains, they say it's cold.
There's no evidence supporting that.
Okay, so what are the other misconceptions? Any other one?
Other misconception. Yes, another misconception is that the surgery is the only treatment for arthritis. There are many modalities of treating arthritis depending on when the patient presents and the severity of the arthritis. So it ranges from simple things like physiotherapy, medication, injections. Surgery is usually reserved for very severe cases, which unfortunately in our environment, that is it at that stage that people tend to come to the hospital. So they will end up meeting the criteria for surgery. But for those that present early, there are other things that can be done. So, something as simple as losing weight, using supports, all those things can be used to manage arthritis.
Okay, because still talking about misconception, there's this idea about surgery that there's no how you go for knee surgery that you not end up on the wheelchair. Is this true? Because I know of some people that are afraid to go, they rather try to manage it. Their fear is that at the end of the day, at the end of this surgery, they will end up on the wheelchair.
No, that is not true. Uh, Total knee and total hip replacement surgeries has been in existence for a very long time, for more than 50 years worldwide. And it has been in Nigeria for more than 20 years. So it's a well-established procedure. People have had, even here in Rio, people have had the surgery, walk out of the hospital. But the advantage of the surgery is that it helps the patient to return back to his normal life, normal activity level. So it's a very dramatic surgery. Somebody that could not walk because of pain, you replace the joint and suddenly pain has disappeared, deformity has disappeared, patient return back to his activity. So it's not correct that patient end up being bound on a wheelchair. Even here in Rio, we've had patients that have had the surgery successfully and return back to their normal activity.
Oh, that's nice. Okay, so let's look at is it curable? Arthritis,
is it curable? Yes, that's a very interesting question. Is arthritis curable? The answer is yes and no. No, in that, okay, usually when I talk with patients, I usually like using this, creating this analogy. Assuming arthritis is like malaria, the treatment, the cure for malaria is to take anti-malaria. Once you take anti-malaria, you've cured malaria at that point.
Yeah.
Whereas if you don't have access to anti-malaria, there is the option of taking paracetamol. You take paracetamol, you feel fine, you feel better for a while. Later in the most likely evening, the symptoms come again, you feel better. That means the malaria is still there, but you are managing the symptoms.
Yeah.
So coming to arthritis, the cure for arthritis is surgery. As I explained, the problem is with the joint, the cartilage is being destroyed. So the surgery involves replacing all the diseased part of that bone and putting a prosthesis to take up that function. That will cure it because it removes the disease, it removes everything. That's on one side. Then on the other side, as I mentioned, it's not everybody that will qualify for the surgery. Okay. So on the other side, what we also do is symptomatic management or treatment. The main problem with arthritis is pain. So we give you pain medication. Okay. But just like taking paracetamol for malaria, once the medication wears off, the pain comes back. So you need to be on the drugs for quite some time, while we also institute other things to manage the arthritis. Okay.
Okay, now let's go back to ways of managing, still talking about ways of managing arthritis. The local therapy, does it really work?
The local therapy?
Yes. People going to our traditional medicine people to seek help. Does it really help?
It depends on exactly what they are doing. But from my own understanding, except the problem in the joint is addressed, which is usually addressed by surgery, I don't see any other thing that will help. But as I mentioned, there are other things like losing weight, which you don't really need to go to a traditional bone person to lose weight. Exercise and move the joints, get support for the joints. All those things will make you feel comfortable. So traditional bone people, there's no specific procedure they have that will say, yes, this addresses arthritis.
Okay. And then we also have the people talking about the use of orthopedic mattresses. Does it help? How does it help? Orthopedic, because it's so expensive. People just feel, okay, it's one of the way out to avoid all of these bone problems, joint problems. So they have to invest in orthopedic mattress. Now you are here, tell us. Does it work?
Let me start by saying that number one, there is no mattress that any orthopedic association in the world sat down and recommended that yes, this is the kind of mattress that we recommend for people. So what happened is that in different companies would just name their famous or the hardest mattress, orthopedic mattress.
Oh.
The mattress that, the kind of mattress you use is actually dependent on your weight.
Okay.
Meaning that somebody that is, the kind of mattress for somebody that is 50 kg is going to be different from the mattress for another person that is 100 kg.
Okay.
If the 50 kg person is lying down on the mattress that is appropriate for a 100 kg person, the mattress is going to be too high for that person.
Okay.
Then if the 100 kg person is lying down on the mattress that is appropriate for a 50 kg, it's going to be too soft. So it's now left for us to find out the kind of mattress that is appropriate for our weight.
So how do we do that? How do we go
Yeah.
about that?
There are techniques that can be used when you are buying mattress.
Mattress.
Yes, I wish it will be difficult to demonstrate here. Eh?
Okay. So you just go jump on the mattress and find out. But some of them are very hard when you buy them.
Yes, over time.
Years,
Yes,
over time,
that now brings up the issue of care of your mattress.
Okay.
The recommended is that every 3 to 6 months you should turn the mattress.
Okay.
So that the
other
side can also take part of the weight. Then turn the head side to the foot side. Just be turning that. After some time, the mattress will need to be changed.
Oh, but this is a very good advice. Did you hear that? Doctor, please could you just recap this? Your mattress plays a critical role too. So doctor just gave us one advice here.
So every 3 to 6 months you turn your mattress over. Then for the first 6 months you turn it over. The next 6 months you can turn it from side to the other side. Then the next 6 months you turn the head side to the foot side. So that way the pressure will not be on a particular part of the mattress. Yes.
Okay. That's a very good one, Dr. Ubong. It's Dr. Ubong is a consultant orthopedic surgeon. Before we let you go, I would love you to just give us the do's and don'ts when it comes to arthritis. What are those things you think should be done if you want to avoid arthritis? And then what are those things we should not do?
Okay, the things that we need to do to avoid arthritis include number one, if you notice your legs are not straight or your child's leg are not straight, let an orthopedic doctor review and see if there's something that can be done. If it's something to be worried about, number one, and if there's something that can be done about it. Because the longer the leg stays in that deformed position, the more the probability of developing arthritis. Then the other thing is we should consciously and intentionally, especially those that are obese, work on losing weight. Weight is a serious factor in arthritis. Then the other issue is exercise. You have to live active life. Make sure your joints are moving, because the more it moves, the more lubricated the joints are, and the less the risk of forming arthritis. Then any injury around the joint is not something to take to traditional bone setters. Any injury around the joint is a serious injury, so you need expert opinion, so that it can, whatever problem it is, can be resolved early. Because once there is a malalignment in that joint, I can guarantee you that with time you develop arthritis in that joint.
Okay, and then before the very last one now, because I had this question here. There's this habit of cracking our knuckles. Yes. How bad or how good is this? Because I really need to know, and people out there, you are also cracking.
That is another that's another common misconception that I forgot to mention. People tend to believe that cracking the knuckles predisposes to arthritis. However, there is no study that has shown that there's any relationship between cracking your knuckles and developing arthritis. So it doesn't cause arthritis in any way.
Thank you so very much, Dr. Ubong. It's been so enlightening speaking with you. And the program was Health Matters, and we had Dr. Ubong Esien, consultant orthopedic surgeon, Akwa Ibom State Ministry of Health, here throwing more light on arthritis. Thank you so much, Dr. Ubong.
Thanks for having me.
Okay, thank you so much. And thank you for staying tuned. Let's do it same time next week. I remain your host, Omo Basedit. Bye.